The field of ALK-positive patients also had very interesting updates, I would say. And actually, there were no really new studies that came up, but there was a very interesting discussions in the field of the ALK arena, and it looks like the newer generations of anti-ALK therapies are providing a much better results compared to previous generations. And as everyone knows, we have different generations of ALK TKIs, and the field showing the retrospective data, including the GLASS data, the global Lorlatinib real-world data that we have collected in Europe and in other countries, shows that patients that were on Lorlatinib in an early access program, actually, post-Crizotinib or post-other lines, showed a very significant median overall survival of 90 months. And it is really important because it is actually duplicates previous studies that shows that when you treat patients with TKIs in a different sequence, you may get to a median overall survival of 85 or even 90 months. And what we have shown in the GLASS trial is that also the population of the ROS1 also had a similar median overall survival. This is, I would say, a very interesting finding by itself. The duration of response was very long. We did have patients even more than 2 years on the treatment. And I definitely see the Lorlatinib paving the way in different lines of therapy, either as a second line or third line. And we did have also patients that got Lorlatinib as an 8th line. And the drug was very well tolerable, and there were no new adverse events. So the known adverse events of hyperlipidemia, some fluid retention were reported in this study. It was also mentioning the cognitive changes or mood disorders that were reported in general with Lorlatinib. So in this real-world data, actually, there was no significant reports about a significant change in mood changes in this cohort. So it looks to kind of a very safe drug. Hyperlipidemia, of course, is an issue, and hyperlipidemia should be controlled. The second generation's ALK TKIs are coming actually to the first line. We do have the Alectinib data, and the Brigatinib data are coming into the first line of therapy. We do have a very good success and similar, I would say, median numbers for both Brigatinib, the ALTA studies, and the ALEX study with some minor changes. However, the overall survival with the ALEX study, Alectinib versus Crizotinib, was significant, even though with a minor change in the numbers. But the median overall survival in the ALTA study was pretty much similar to both lines. So Alectinib did show some overall survival benefit in the cohort that started Alectinib compared to Crizotinib, while Brigatinib did not show that. What is really interesting, even though it is not registered yet, that the CROWN study that compared Lorlatinib to Crizotinib shows a very, very promising PFS curves. And even though it is very early, I would expect to see overall survival for this cohort, but we should wait and see how the data is going to be mature. But definitely the data of Lorlatinib as first line are really very impressive, and we see that a real plateau in the overall survival curves and it will be very interesting to see how it is going to look like in the next year or even 2 years. It looks like we are playing with the same agents at the moment with the ALK. We are shifting the newer generations to an earlier lines, and I think that there is a real unmet need to see how should we act once we do have a progression on those newer generations. I think that the liquid biopsy is going to bring us some news about that, and I hope we will have an answer.